October is Breast Cancer Awareness Month. This morning I'm joined by a breast health specialist and a breast cancer survivor. Let's meet Dr. Claudia De Young and Jennifer Morgan. Nice to have you both here so bright and early this morning.
Good morning.
So Dr. De Young, this is something that's very much in your wheelhouse, and I'm glad we're getting this in. The month, Breast Cancer Awareness Month ends on Friday. What is the number one thing you can impart for people? Is it self-checking, self-awareness, or fill us in on that?
My gosh, I don't think there's one thing. I think
Okay.
screening's very important, sure. But I think, bringing Jennifer in this morning, one of our messages is breast health awareness. Because even though the average age for a woman to be diagnosed with breast cancer is in her 60s, cancer doesn't always play by the rules. And we're seeing more young women being diagnosed than ever before, even before we start the screening at 40.
Right.
So Jennifer is a great example of, hey, I felt something. I don't want to assume it's nothing, and thank God, because she was diagnosed with breast cancer at 32.
Yeah, at 32, you're 36, just had a birthday. Happy birthday, Jennifer. Glad you're spending your birthday with us.
Thank you, glad to be here.
So at 32, no family history.
None.
How did you know in terms of self-check? Is it in the shower? When do you do that?
Well, when I found my lump, I was sitting on the couch eating breakfast and I had an itch just right here. And
no kidding.
I said, that feels really weird. And I remember I called my mom and I said, I think it's something. And she said, okay, we'll make a doctor's appointment.
What made you think it was something?
It didn't feel like, I was like, okay, that feels like a pebble.
Okay.
Kind of like a
and
rock or
where
a
was
pebble.
it? Up in here?
Mine's was right here.
Okay, doctor, is that somewhere normal where it would be cause for concern?
Right. I mean, we have breast tissue all along the chest in a woman, and even though the most common area is upper outer, I think anything new or different needs to be checked out. You can't just assume, hey, it's just, a skin cyst or it's nothing to worry about at 32. And I think that's what our messaging is here today.
What was her journey after the self-diagnosis? You go and get checked out.
I do.
And were you told right away what it was?
No.
No kidding.
I had to do
an ultrasound.
Thank you. That's the word, an ultrasound. And then, the main thing was she was like, well, just don't worry. We're going to take care of you. And I said, okay. And then from the ultrasound, it was a biopsy. And then after the biopsy, she called me and she said, I meant to take care of you. And I don't want you to worry throughout the whole process.
Was that comforting?
But it is very,
you had a passionate advocate for you.
I have such an amazing care team at Kaiser. And because she told me never to worry, my entire journey, not once. I was never worried.
Doctor, how much is it psychological in terms of the journey? Of course, it's medical and testing, but also the part of we've got you.
Huge. Huge, because it's so scary. It is so scary to get that diagnosis. I think there's a lot of loss of control. There's a lot of unknowns. So to know you have a cancer care team that's going to be taking care of you and ensuring you get the best of care. We do it great at Kaiser Permanente, but so many facilities do nowadays. Treatment is better than it's ever been. And I think there's a lot of solace in supporting our breast cancer survivors to let them know that they're not alone. We got you, and we'll take one step at a time and ensure that they get the best of care.
Is it earlier the better in terms of all this, in terms of ultimate survivorship?
For sure. For sure. And so that's the messaging. You just can't assume that it's nothing. Come on in. We caught her breast cancer early. She did not need chemotherapy. She had surgery, radiation. She's been on anti-estrogen medications. It hasn't been an easy road. No. But we caught it early. She's got a great care team, and she's doing great.
Yeah.
So for you, going forward, just had the birthday. What extra do you have to do? Are you self-checking all the time?
All the time.
Have you been told you're in the clear? Is there a clear?
Yes and no. They will tell you your chance of reoccurrence percentile-wise. Mine was low, thank God, which is why I didn't need to do chemo. And then I have 2 more years being on my anti-estrogen medication, and then from there, she's with me. Like she said, I'm with you for the rest of your life.
So far, so great.
So far, so great.
Okay.
Love it.
We'll
It's
take
the care
that.
team.
Dr. Jennifer, thank you both for coming in. Do appreciate that.
Thank you.
And this is a great story. Okay. Thank you both.